Good morning, I'm Dr. PK from Dr. PK Live. In this video, as a part of the hemolytic anemia video series, I'm going to talk about the sickle cell disease causes, symptoms, and crisis prevention and modern treatment. Welcome to my channel. We are talking about a genetic blood disorder called sickle cell disease, which affects millions of people worldwide, yet is still misunderstood. Sickle cell disease, condition called severe pain, crisis, recurrent infection, organ damage, and reduced life expectancy. The good news is that early diagnosis, prevention, and modern treatment can dramatically improve quality of life, and we're gonna touch all these. So let's understand it step by step. What is sickle cell disease? Sickle cell disease is a genetic hemolytic anemia. Normally, red blood cells are round and flexible, and they flow smoothly through blood vessels, and they live about 120 days. But in sickle cell disease, red blood cells become crescent or sickle shaped. They are rigid, they are sticky, they break down early, and they cause chronic anemia. They block blood flow, and that leads to pain and organ damage. This leads to continuous hemolysis, which is destruction of red blood cells, and oxygen shortage. Why does this happen? The cause is a mutation of hemoglobin gene producing hemoglobin S, HbS. Inheritance pattern, both parents must carry the gene. Child gets one abnormal gene from each parent. Sickle cell trait is different. There is only one abnormal gene, heterozygous, usually no symptoms, and can pass it on to children. In sickle cell disease, you have two abnormal genes and you have full disease. That's why genetic counseling is critical before marriage or pregnancy. Common symptoms, chronic symptoms, fatigue, weakness, pale skin, shortness of breath, delayed growth in children, pain crisis, it's called vaso-occlusive crisis, sudden severe bone or joint pain or sternal pain triggered by dehydration, infection, stress, cold, infection. Most common reason for hospitalization is pain crisis. Serious complication, stroke, especially in children, acute chest syndrome, recurrent infection, kidney damage, vision problem, leg ulcer. How is it diagnosed? Straightforward. Newborn screening, very important. Hemoglobin electrophoresis, genetic testing. CBC showing chronic anemia, peripheral blood smear showing sickle cells. Early diagnosis saves life, especially in children. What are the treatment options? Now, there is no single cure for everyone, but treatment had advanced tremendously. Daily management, you need folic acid, good hydration, avoiding extreme temperature, prompt treatment of infection. Medication is hydroxyurea. It reduces pain crisis and hospitalization. Newer agents, biologics that reduce hemolysis and improve blood flow. During pain crisis, patient needs IV fluid, oxygen, pain control, and treating underlying infection or causes. Advanced option, regular blood transfusion, iron chelation if needed, bone marrow transplant, and potential cure in selected patient. So lifestyle change is very important. Your strategy should be stay well hydrated, avoid extreme temperatures, get all recommended vaccination, regular follow-up with your hematologist, genetic counseling for families, and early screening for newborns. Education and prevention are as important as medication. So things to remember. Sickle cell disease is a genetic hemolytic anemia, causes chronic anemia and painful crisis. Early diagnosis improves survival. Modern treatments significantly improve quality of life. Prevention and education and follow-up are life-saving. And if you or a family member has sickle cell disease, knowledge is power. If you found this video helpful, like, share, repost, subscribe to Dr. PK Live. And thank you for watching.